Hello and welcome. The state of Uttar Pradesh, India's most populous state, has seen quite a dramatic turnaround in terms of positive turnaround in terms of number of COVID cases in the country. The number of cases at last count were barely between 15 to 18 cases and mostly on the lower side. Almost no deaths for many days, and almost 33 districts out of the 75 districts have actually reported no case at all or have no active cases, while some 67 districts at last count have no new cases being reported. So overall, it would appear that a state of over 200 million people with 75 districts, making it as large as many countries or larger than many countries in the world, is seeing almost no COVID cases. So that's the good news. On the other hand, the state's also seen a fairly severe wave of dengue, which a disease or infectious disease that many people in Western India would know, particularly as it comes during the monsoons. And that's something that the state has had a bit of a challenge trying to catch up with and trying to resolve, and has seen almost 60 deaths. So the questions that that arise in some ways are what are the lessons that a state like UP has taken away from from what it has experienced through COVID. Remember, at peak there were almost 350 deaths a day. That's the official numbers. Generally, it's believed in UP, like in many other states in the country, that the number of deaths are not an accurate representation of what actually went on ground. But be that as it may, what is the strategic response that a state like UP is taking as it looks ahead? How much is it going to focus on prevention? How much on cure? And if it's cure, how does that break down into in terms of particularly local infrastructure, both at the medical level and the physical level? To discuss this, I am joined by Pratap Singh, the Cabinet Minister for Medical and Health, Family Welfare, Maternal and Child Welfare in the state of Uttar Pradesh. Mr. Singh, thank you very much for joining me. So let me ask you a broader landscape question. As you look back, particularly in the last year and where you are today, how would you describe UP's health system and its preparedness for disease outbreaks?
We had a very, I would say we had a very tough time when we came into contact with the COVID pandemic. That was, if I remember correctly, on the 8th of March 2020, we got our first case, which people had come from Italy. And we didn't have any particular specialized place to look after them, and so we referred them to Safdarjung Hospital. That was the first 2-3 cases which came to us from Agra. And we had only one testing machine in King George Medical University, which could test about 70 cases a day. From that day onwards, our Chief Minister insisted that we put in all our money in increasing our infrastructure, our testing facilities, our bed occupancy, increasing the beds availability at even up to the community health centers, and to make sure that every medicine, every type is available over there. And also then including checking of our borders with Nepal, checking of trains, checking of everything possible, whatever could be what thought of. We started this on a war footing, and 2020 we did do pretty well. Whatever the virus in whichever state it was which came to us was well handled, and infrastructure went up, number of beds, L3, L1, L2, L3, different categories, and along with medicine and the doctors and paramedics, everything came into place in a very short, quick time. And we were able to contain and keep it down as much as possible. And testing, of course, went up quite a bit. So with that, we were quite well prepared as far as 2020 was gone. Thereafter, as you all know, what happened in the country, because in 2021, when the virus re-emerged in a different mutant variety, it was a total setback to all the preparedness of whatever we did, whether it was UP or it was all over the world, I think. And we suddenly found ourselves facing an oxygen shortage because it was affecting the lungs immediately. And after affecting the lungs, people were running short of oxygen cylinders. Normal oxygen plants which were running at a very small pace, which were just being used for operations, was suddenly converted to high intake of oxygen for these sort of patients. And all of a sudden there was a shortage of oxygen all over the country. And as you know well, and we all know, that at that time the Prime Minister and his cabinet stepped in. All oxygen plants were taken over by the Government of India, and allotment was being given to each and every state And so we got our allotment from Bokaro, from Jamnagar, from wherever, from all over the place. And on a war footing, we got all those oxygen tankers and everything straight to our hospital and ensured that our government hospitals right round all 75 districts, including hospitals were connected to us, private medical colleges, private corporate hospitals which were connected to the system, were given oxygen and oxygen cylinders and plants as much
Right.
as possible so that they could keep up the look after the patients as far as possible. So this was at that time. Uh,
Right. So if I were to now bring you to the present, so there are two kinds of questions which sort of spring from this. One is, what are the lessons that this has in a way given to all of us in terms of health preparedness? So you had a dengue outbreak more recently, and obviously dengue is not the same as COVID-19, but it can be equally debilitating, and obviously it also leads to casualties. So is there a link between, let's say, the state of health preparedness before and post-COVID, which could have perhaps changed the approach, or is it something that you would do going forward?
no, I think when we started with COVID pandemic from 2020 and 2021, in between what we were doing continuously was ensuring that all the gram panchayats, nagar nigams, nagar palikas, I mean the city and the urban and the rural areas were properly being fogged, being fogging, spraying. This is a regular thing which we do each year. Spraying of in houses where there's lava for dengue and things like that, checking that. That was being done in 2020 also, along with the containment of COVID. And we ensured that it happened in villages as well as in Singh. The drains were being cleaned up properly. We did that in 21 also. And along with that, apart from dengue, we were also doing Japanese encephalitis in 3 or 4 stages, where we were doing 100% vaccination for children above a certain age, so that they would be vaccinated totally against a particular disease. So dengue has a cycle roughly about once in 3 years. We had a problem in 2019, and this time we saw that it suddenly came up again. All of a sudden, because we had very heavy rains, and then again I can say that rains were all over the place. So we had very heavy rain, and after the rain there was a lot of waterlogging. There was a lot of problems we had in cleaning up the garbage and everything like that. So I think from that we suddenly found an outbreak of dengue recently in Firozabad and Mathura. And by the time our people got into action, because you see what happened was initially people who had this problem, they did not come to the government hospital directly. They went straight to nearby private hospitals, and where there were a lot of deaths which occurred. Some children died at home also. And by the time we got into action, the damage had been done, and we got our teams together. We started doing house to house surveying, ensuring that whatever little water was being held up in containers under the fridges and here, there, everywhere, and giving them warnings, making them aware of what has to be done. Then that was done at a very quick, fast pace, and to contain what happened in Firozabad, especially with dengue. And Mathura was, of course, a little bit different, because suddenly you found out diseases like strep, typhus, and leptospirosis. These were something new to us. But again, as it was being tested by ICMR and whatever reports we got, we changed the medication, we changed the type of whatever we could do, and put them into government hospitals. So it had got contained, but it had given us a bit of a damage. And despite all our preparedness, there was a lack of system somewhere over there.
Right. Yeah. So if I were to ask you to define a health strategy going forward, how would you, or are you dividing your time and attention in terms of again, how much prevention, how much cure, how much communication, and how much maybe even preparing? So for instance, you talked about the rains and that obviously creating pools of water which maybe saw the collection of mosquitoes and led to dengue. Now the rains, I guess, is the trigger to for the administration to start moving on other things. So tell us about how that works.
No, what happens actually before the rains is generally a directive given every year to all the concerned departments that every drain should be absolutely cleaned up just before the monsoon. There should be fogging going on, there should be spraying going on. Generally, this happens every year. Now, when you have more than the required amount of rain which came in this year, was very heavy rain, so your drains can only take that much of water. and no matter how clean you keep it, the water somehow has to go about everywhere else, and so it gets locked in places where there's less construction, or maybe there are construction places, there are gaddhas, a lot of places that get locked on. So that is where our problem starts. But then this is not a 1 year thing. You see, in the health department, we already have a system which every 3 months we have a sort of a program for not only for dengue, we have for dengue, we have for chikungunya, we have for H1N1 flu, we have for Kala Azar, we have for Japanese encephalitis, we have for AES, and we have for diarrhea. Now, everything, when something happens together, we are just getting out of COVID and suddenly you come across an outbreak of dengue, then you next thing you get to know that there are a lot of cases in Lucknow coming up with diarrhea. And all of a sudden, in a different area, Eastern UP, you suddenly found few cases of Kala Azar. Then you are rushing around there, then you're getting the JE done. But these are all programs which are there in the department, and we do it from time to time and ensure that the more amount of the teams go about to all these areas, the better we are prepared. So, despite our preparedness, I can admit that point that we were on a bit of a bad footing, because after going through a rigorous COVID management and then coming down to this suddenly, but we've got that under control also now. There's not a problem now. All the government hospitals are totally prepared now.
Right. So again, if I were to come back to the strategy question as you look ahead, there is a certain design India's healthcare system has. I mean, obviously, almost 80% of it is private, 20% of it is public. More people prefer to go to private than to public. And as you mentioned, maybe people chose to go to private first, did not get the right treatment in the case of dengue, landed up in public, maybe it was too late. So how would you, or are you thinking about this going forward, particularly given that this is India's largest state that we're talking about?
What we started doing is, we were doing it just after, say, in April or May, where we had ASHA workers. We have ASHA workers, we have Anganwadis, we have a whole lot of field workers. We had already started initiating them and training them and telling them to go to each and every household. They were doing it in 2020 for COVID also. They were doing it in 2021 also for COVID. And just after COVID was tapering down, we started using them for survey of each and every household to see what sort of fever will be coming up next. So this was already going on progress, and the idea of doing that was to tell them that if you have any sort of fever which is not being controlled over a period of 2-3 days, then you must come to the government hospital, where you'll be tested for dengue, you'll be tested for different types of diseases for which we already have the facility now. Almost in every district we have a facility. So keeping that in mind, we were using this force, the field workers, in a very big way. And that was also an awareness program for a whole lot of other things. Apart from telling them that the government is now fully prepared, you must come to the government hospital for any of your ailments. We also use this for TB fact-finding machines also, to try and find out if there's anybody who has a TB problem also. Also, we use it for our Ayushman Bharat cards to be made, anybody who doesn't have a card in that family. So this is a way of doing everything. So that is one way. The second way is to get all our hospitals well fortified with doctors at the primary health center, at the community health center, with proper medicine availability over there, and lab availability, good lab availability at the community health center and at the district level, and to ensure that we have a good amount of doctors and paramedicals, so that any sort of diseases will come, when the public comes to us, then they should know that in the government you'll be able to get it, because there is a lot of dependence on the government. The population is huge. Our infrastructure covers about 30-35% of whatever we have today, and as you were saying, it's more of 65 to 70% is private and 30-35% is government. But yet we have a lot of dependence on our government primary health centers and also on the community health centers. At an average, I can tell you that we have an OPD of roughly about 10 crores in a year. Right from our PHC to our community health center to our district health center, and today we are evolving with health and wellness centers and sub-centers, which we are going to improve our technique for, especially for deliveries, because the basic primary the motive of the health sector is also to reduce our infant mortality and mother mortality, the maternal mortality. These, when we get reduced, then you get a better health quality life also. So a lot of emphasis is on a lot of programs which are going on today I mean, if I start talking about that, it will take at least an hour or so. But yeah, we're doing everything possible today now.
Right, and I will come back to you on that at a later point. But so coming back to COVID-19, so you have about 103 million doses or 10.3 crore doses that have been administered. Your seroprevalence studies seem to suggest that almost 80% of your state population, above 18 that is already carrying antibodies. So is that giving you comfort, or if not, what are you looking out for at this point from where you are and what you know right now?
One thinking is that you mentioned Zero Survey. We know that it is covering almost 80%. It is showing antibody, this thing. We have at the moment about 57.3% people of the targeted population have been given the first vaccination dose, and about 14 or 15% has been given the second dose. Now, first dose, of course, when you give the first dose, what ICMR feels is that even if you get one dose, you are immune up to the percentage of 96.6%, and then whatever the second dose gives it. But then now people have also gradually got to know that they are quite immune to any sort of thing because the antibodies are well developed, whatever way it's been developed. But we are insisting that everybody has to have the second dose also. So we are calling them up through our call center. We have a special day fixed for this, a Saturday which is fixed on each week, and we are ensuring that everybody gets a call and they have to come and have the second shot done, whether the antibodies are developed, because that's not a very open this thing. As far as we are concerned, the security of these people is better when they given the second shot, and they'll be at least immune to COVID for a longer time. So our study is that we will give all the shots, and we are the amount of vaccines which are available to us. Like just yesterday, we did about, I think, 36 lakhs, 88,000 in a day, and almost 3 crore 25 lakhs we've done in 1 month. So our target is to try and get us this entire population vaccinated by December 2021, if we get enough availability of vaccine as what is being given to us today. And as you know, ICMR is also now finalizing Zydus Cadila for 12 years and up to 18 years also. So once we get doing that, we'll be doing that also. So this is the thing.
Right. So last question. So as you look ahead again with COVID in the rearview mirror, what are your key concerns from a broader public health point of view and that you are working on? And that obviously may include COVID, but it may not.
Basically, we have to try and improve our health infrastructure also at this time. After COVID, whatever shortcomings were there. Now, as you know, that suddenly we were told that third phase, the third COVID, pandemic might be coming in terms of for people under 18, for children under 18. Now, that was a theory because obviously the vaccine which is coming is only for 18 and plus. So somebody said it might infect people under 18. But now what we are seeing, apart from the Zero Survey, that the amount of population which is being vaccinated at such a fast pace all over India and UP, I don't think we see any possibility of the third phase. But because of that, we improved our health sector. We initiated all the safety regards as far as pediatric ICUs and trained our doctors and ensured that every type of basic infrastructure of digital X-ray, ultrasound, small ICUs, oxygen concentrators, oxygen generating plants, all these are on way to being put up over there, and a generous amount of medicine, specialist cadre. We've already put in a want for specialist cadre through the UP recruitment board, which is the Lok Seva Ayog, and we've already been given 1,000 people who are interested in coming to the UP service. To make sure that specialists are at the community health centers, ultrasound, digital, good lab techniques, and good amount of medicine, beds availability, oxygen concentrators, oxygen generating plants, and everything which is possible for a normal disease. Even when we have dengue, we are putting them there, we are treating them under different circumstances, whether it's dengue or whether it's any other disease, up to an extent. And then we have medical colleges which are now getting established in every district. We had medical colleges from 1947 to 2017 were about only 12 medical colleges which were made over the period of a long time. Right. And with our Chief Minister, he has been pushing for each district to have a medical college. 9 are being already going to be inaugurated by the Prime Minister. Another 12 or 13 are being constructed, and 16 districts are going under the PPP model tender, which is going to start any day. So overall, we're going to have 45 so almost medical college in each and every district, which will generate a lot of doctors. 100 seats per medical college. We are hopeful that once this starts off, so we get 100 doctors through a agreement system. They will come to our service. They'll be there at least minimum 5 years at a PhD level. So there'll be no shortage of doctors. This is what we are planning. And along with that, generally just improving everything possible in the health sector, what we can do.
Right. Mr. Jai Pratap Singh, Cabinet Minister for Medical and Health, Family Welfare, Maternal and Child Welfare from the state of UP. Thank you so much for joining me.
Thank you very much, sir.